Right. So hospital, and today I've got Martha Laxton-Kane. I hope I pronounced that the right way.
Yeah, that's right.
So I'm just aware that we did a manager's briefing guide on mental health and things like that, and so we just wanted to do a VODCAST and just share some other things with you. So really, I suppose the first question is just tell us a little bit about yourself and your role and things like that, and then we'll go through some of that briefing guide that you did.
Yeah, okay, great. So my name's Martha Laxton-Kane. I'm a clinical psychologist, and I lead a couple of the CAMHS teams within the CAMHS service here at Chesterfield Royal. My specialism's more around kind of sort of learning disabilities and autism and young people with mental health problems. But I guess all my kind of training and approaches to my work, or, you know, some of the discussions I've had with you, it's all based around psychological understanding and theories and models about kind of sort of mental well-being, really.
Brilliant. And I found it quite fascinating myself the more I've delved into this subject as well. Yeah. I've certainly picked up a lot myself during COVID-19. So we've just got a few questions, and I think I'm going to refer to a model on the screen. Yeah. So I'm just going to share it now. Right. And really the question is on the model, if you could just explain it when I get this up. So hopefully that should have come up on your screen. Right. So yeah, if you can just tell us a bit about the PAR model. So it's PAAR. Yeah. So just let us know what's happening in this graph and the different phases that we have to go through.
Sure. So just to say, first of all, something about any sort of psychological models, but particularly these kind of models that are around at the moment around trauma and that kind of thing. This is just one model, if you like. But our understanding in the research and practice is built up over time, you know, in response to stuff like the events in Northern Ireland, you know, Manchester bombing, and also, you know, lots of the kind of wars, really. So this is just one way of looking at it. But in terms of this model, this was introduced by the British Psychological Society more recently in response to, you know, COVID-19. But it's really helpful, really. And if I'll just talk you through each stage, if that's okay. So the first stage there is around preparation, and that's very much that kind of sort of anticipatory sort of phase and a lot of anxiety. And during that initial phase, if you think about what happened, in a way that was sort of like that build up to lockdown that few weeks or so before. I think we all knew something was coming, didn't we? But we didn't quite realise, you know, but it was very fast and very kind of sort of, you know, everything escalated really, really quickly. And at this stage, I guess what we saw was a lot of rapid changes, a lot of quick decisions being made, you know, across the whole of the NHS, really. And everybody was very much quickly in the zone and wasn't quite sure what was going to happen. And then after that, there was kind of more of the active phase. That's the second square you can see there. That's the active phase where we're in it. And everything was around kind of sort of solutions, as it says there, and engagement. And I think at this stage, what a lot of staff experienced and reported really was there was a lot of camaraderie, really. You know, I think people were, you know, kind of taking up the challenge. There was a lot of ideas. People were being really creative. Things were still happening very quickly. I think people's arousal levels were quite high. I know for me, I had probably about 4 weeks, you know, feeling kind of sort of quite up there, mixture of anxiety, being on the go all the time, not much space to manoeuvre. And I think also at this time, as things were happening so quickly, and in terms of this model, what it's talking about is that also, because decisions are made quickly and many staff were having to work in areas that they weren't kind of quite familiar with and having to get trained up quickly, in some sense, it was also perhaps probably feeling a bit out of control, if you like. And at the same time, as for absolutely everybody, not only were the, you know, kind of changes happening at work rapidly, changes were happening massively at home as well for many of us. And so there's likely, you know, again, at this sort of active stage, probably some tensions around between home, you know, sort of home work-life balance. Then the next phase there, the active phase, kind of moving to a bit more of an exhaustion. And that's more about you're still in it. And probably, you know, from sort of 2 to, you know, who knows, 6, 7 weeks on, that's more about people are kind of maybe getting used to things. It's still very quick paced, lots of decisions, but actually people are getting a bit fatigued really, and as it says, exhausted. And still lots of decisions are being made. This is, I guess, a point also when there might be tensions arising for many of us, and that might be tensions to do with home and work, or it might be to do at work as well, you know, because I guess all of us are perhaps, you know, in those kind of phases a bit less tolerant, if you like. And I know for myself in that, and certainly in that phase, which we're still in to some degree, but I really noticed it settling in for me when I'd be at work all day and I feel really tired, been lots of things going on. And then I would be then ringing my mum, checking with my mum. So my mum's 84 today actually. And, I would give her a call as soon as I got in from work. And she's been in on her own all day, you know, she's done the odd call, but she's, desperate to speak to somebody and chat. And I probably wasn't so tolerant at that stage because I was already full and kind of had enough of things. And then you're trying to see to the kids and things. And, and I think for many people, also at that stage as well, that exhaustion, you are that kind of trying to see to your commitments at home as well. I know for myself and quite a few other colleagues as well that people would actually booked in quite a few days of annual leave just to kind of sort of try and recharge a bit, but try and sort things at home as well. So, and I think also during that time that we're certainly at risk of kind of sort of neglecting ourselves physically and psychologically, really. Then moving on to the next phase that here in this model, this talks about the sort of recovery phase when we're thinking more about the potential sort of long-term impacts and what that might look like. We're still likely to feel quite niggly and perhaps overwhelmed, and again might experience some resentment, might experience some excitement about new ways of working and things, but also we might have like kind of conflicting feelings about what's happened. People might be really glad to have worked on different wards or different areas, but also there's a lot of loss for many of us in different ways, and some of our kind of sort of normal coping strategies might not have been the same, might not have had access to them in the same way, might not be able to hug people or be with people, meet family and friends, But also, although this is a model, it's not just a linear process, and, we might go back and forward throughout it, and it's probably a bit hard to know exactly where we're at the moment. So does that make sense, Andy?
Yeah, that makes perfect sense, and I'm glad. I'll just unshare this now, so it goes back to
okay.
I think that's really interesting, and of course for the frontline staff that have had to change wards and different roles and responsibilities, the anxieties around that, and also people that have been affected by shielding or working from home. And that balance, and like you said, I think across the board and across all staff, it seems to be that there's a mixed bag, and it's been a balancing act of loss, like you were saying. And it's really interesting that you mentioned those coping mechanisms that have been removed, such as the hugging and the contact with family. So I suppose that leads really nicely on to some of the common psychological responses to trauma. So I know you mentioned the military there and the Manchester bombings and things like that. So in terms of trauma response, what are some of the common psychological responses?
I guess, for many people, when you have something that's really traumatic or really difficult, most people will kind of default to their sort of normal coping strategies. And for many of us, we probably have kind of a mixture of normal, if you like, or healthy kind of coping strategies. And also we probably have also some perhaps unhelpful ones. I know many people talking about, oh God, they're having a drink every night now, and different things like that. So for many of us, it kind of like our sort of normal, if you like, coping strategies become more there in kind of sort of more extreme. But I guess what's different in this kind of circumstance and this the pandemic is that none of us have probably experienced anything like it beforehand. And, that has been a challenge, as I say, because some of our normal coping strategies have been removed. So, I mean, I think one of the really important things, though, is that everybody does have different coping, styles, if you like. Some people want to talk about it. Some people, want to get home and talk to other people and say how difficult things have been. some people, you know, just don't want to talk about it and they want to switch off. You know, they want to go for a walk or just watch some television soaps, and that's absolutely fine, you know. Some people, you know, very much, there was a lot on social media kind of sharing funny clips, if you like. That can be that, and that's absolutely fine. That's really, you know, really helpful as well. But I guess one, you know, important thing to say, Andy, is that, you know, different people have got different coping styles, and people might have, I suppose, be at different places at different times. And I don't know about yourself, but for me, sometimes when I'd feel really full and just absolutely kind of had enough, or might be feeling a bit flat, I found it really hard if people were sending me clips, you know, funny clips about what was happening. I couldn't watch it. I wasn't at that point. Does that make sense? But then another day, you know, might feel much perkier and a bit more optimistic and things, or have, you know, lots of kind of good ideas. And then I'd be, you know, you could be much more open to watching those kind of things, really. But I think, you know, what this has really told us, and what we know from other situations, is, you know, I think lots of all these different types of responses, whether you're having to be a bit quiet, you're feeling a bit flat, you're feeling anxious, you're feeling stressed, you need time by yourself or time with others, they're all really, really normal reactions to a really intense situation that's, you know, it massively affected our work and home life, you know, and still is doing as well.
No, that's brilliant, and it's funny how you know, you mentioned, because I can see myself in this, like I'm sure a lot of people can.
Yeah.
You know, your different moods each day. Sometimes it's like wading through sludge almost, isn't it? Then other days you find yourself really motivated. So it's interesting that you said that. So if I just get up the next questions, and I think also the balancing act. Sometimes I've found myself as well, but when I've spoke to other people, that you feel as though, because you see somebody react differently, that you should react like that, when actually, whether it's going for that walk and not talking, or whether that's talking, or even watching trash TV, you know, however you dump your something's finding that into. So yeah, that resonates. So in terms of the model, you did mention this as well. Which phase do you think we're in at the moment? Is it still an active phase? I suppose that's a difficult question.
Yeah. Who knows? I think we're still in an active phase, but we're probably more in that exhaustion phase. And I think people are thinking, what's next? What does it look like? You know, just as, you know, everybody is on, you know, different kind of sort of work environments. We're probably more in the active phase, a bit more of the exhaustion phase, but perhaps we're beginning to move towards that sort of recovery. But I guess it is unknown as well, isn't it? So we're kind of preparing for the recovery, but of course we're all thinking, is it going to go up again? Hopefully we'll be a little bit more, you know, we'll be more prepared for that. So I think we're kind of somewhere in there. Although again, as we were saying, we might well move back and forwards a bit more so.
Yeah, that's an interesting take. And in terms of normalising and this processing idea, so as you're going through a traumatic event and the adjustment and the processing, what are the potential problems, if you like, the sticking bits within that process where there might be a little bit extra support needed?
Yeah. I guess, I mean, I think it's fair to say, Andy, that the majority of us and the majority of people will probably kind of come through the other end, whenever that may be, by using our sort of usual support networks and coping mechanisms. Might take longer, you know, for many of us, and we might keep going over certain things. But it may well be, particularly as we're kind of more in this exhaustion phase or move into the recovery, that people are beginning to reflect on about, you know, what's happened and you know, and kind of perhaps reconsider some of the decisions they made or actions that they took, where perhaps people have worked a bit outside of their kind of sort of normal practice. So people might at those times begin to feel a bit, you know, kind of lower or more anxious, or kind of sort of destabilised, sort of like kind of questioning themselves about their role and, you know, the whole purpose of work and kind of what the future holds. So we might see some of that kind of unstuckness or unsettlement, you know, kind of coming along. And I think the thing is, Andy, as well, that's not just now. You know, it might well be that people are okay for a bit, but in 3 months' time or 6 months' time, you know, as you begin to sit back and think, crikey, what was all that about? What happened? You know, that we begin to kind of question, you know, how did we respond? And some of us might well be doubting some of the decisions we made, you know, and particularly people at the forefront of it, because we're having to make such quick, you know, decisions under such pressurised situations.
Yeah, so I suppose it sounds like you could be unnecessarily hard on yourself as well in that reflection process. And I think there's also a narrative around, everybody's got a story to tell in this, haven't they? An experience, whether that's personally or at work or a combination, you know. So really interesting.
Yeah. I was just going to add as well, I just want to say as well, just one thing, you know, there was always this kind of sort of old-fashioned, I think, idea, and it certainly was around, you know, for up until, you know, probably the last sort of 10, 15 years, that whenever there was a traumatic event, you should kind of, there was this notion that you should bring in all the psychologists and all the mental health experts, you know, to help everybody and sort it all out. But, you know, what we know now from research and the events, particularly, you know, perhaps around Northern Ireland and some other really kind of sort of significant tragedies that have happened, is actually that can be more distressing, getting people to suddenly open up about their feelings with somebody they don't know, unless they want to, of course. That could be more distressing, you know, and kind of be counterintuitive to the recovery process than actually as using our kind of typical coping strategies or making the most of our own, you know, kind of sort of current networks and coping kind of networks and teams.
Yeah, no, that's really interesting. I find that fascinating as well. And that leads on to the next question, actually, which was the timings of interventions and support, which you just said is allowing that buffer period, that time period, if you like, for people to use their existing buffers and networks and things. And then the timing is crucial. So when the support is put in place, the opportunities for support.
Yeah, absolutely. And I think, you know, particularly when people are in it, it's very much about, I think it's really important to think about the importance of teams and managers and people, you know, the support within our own service and in our own systems, whether that be family, friends, colleagues at work, because ultimately that's what people will use and that's what's going to be really important, which really, you know, kind of sort of emphasises how important the role of the manager is within any service or team in our hospitals at, you know, at the moment. As time goes on, people might want to debrief or talk to somebody else, and that's fine. Many people won't, and that's fine as well. But I guess in terms of timing of interventions, you know, I think my view is that things need to be a whole range of options needs to be available for people for quite a while, and people certainly shouldn't be, you know, forced to do anything or be sent to see anybody or feel as though they've got to, you know, go and see a counsellor or anything like that. You know, it's often about teams talking about things or people using the current sort of supervision or peer support, because then you've already got that established kind of sort of relationship, really.
And in terms of managers as well, obviously managers, I'm presuming you manage a team yourself as well, carry a lot of responsibility in terms of the business as usual stuff, the appraisals and managing a team. And then you've got this COVID-19 situation that's been pushed on, and the importance of managers recognising their own health through this and carrying that responsibility and maybe the accountability they might feel to give their staff opportunity to offload or whatever. But I suppose at the same time they need to be aware of their own health in terms of.
Yeah, absolutely, Andy. And I guess what we've been talking about and you know, about that kind of sort of that model, that graph, that, you know, that response, it's not just, you know, for individual people. It's about people at all levels, all professional backgrounds. We'll all, you know, my guess is many of those things we've been speaking about will resonate with lots of people, no matter what role, you know, you've been doing, whether you're doing, I don't know, a purely administrative kind of function and, you know, really important support point, or you're you know, a healthcare assistant in our emergency department. So it's really important, I think, for everybody, whoever you are, whatever, you know, kind of sort of profession you are, to be thinking about your own, you know, psychological well-being and your own health, really. Yeah.
So in terms of top tips and this balancing everything, as you can see in my background, I've got a kitchen here, I ain't got a bookcase, working from home. And in terms of tips for your own psychological health, is it generally just being aware of that, being aware of the breaks, maybe things like that, your buffers, and bringing it all together, what we spoke about, really, I suppose.
Yeah, absolutely. I guess one of the you know, one of the important things we've spoken sort of quite a lot about at the moment is that I think, you know, many of us are probably a bit more niggly at times or impatient of different things. And actually, you know, even if we're just recognising it, that's, you know, that's really important. But absolutely having time out, you know, whether you're going for a walk, whether you're speaking to somebody on the phone, whatever works for you, that's fine. But it's really important about, I suppose, being mindful about how you are feeling, and recognising that, and then you know, to do something about that, whatever it is that you find helpful, whether it's cooking, going for a walk, speaking to somebody on the phone, whatever works for you. But equally, you know, I would say, and again, this is about, I think, really important, it's about the role of the managers as well, you know, in our service, is that they might want to have some conversations with their staff if they feel somebody is getting a bit low, or they've been a bit niggly, or they're feeling they're a bit anxious. You know, it might be important just to check about how somebody is feeling, and you know, for many people, just chatting about it, that's absolutely fine, you know. But for some people may well, you know, want to access additional types of support at some point or other as well.
So coming on to his last questions of give some examples of supporting your team. So again, you're really good at this as well, Martha. You answer questions ahead. I think
good.
So it's really good. so when you were saying talking to somebody, or it could be team debriefing, peer support, communication, buddying up, or you know, and there's not a set structure, I'm guessing, you know, but there could be some examples of things that may work with people like that. Yeah.
I guess, you know, ultimately, and I think I put this in the briefing, that research tells us that, you know, a well-functioning team with good communication systems, so regular updates, then a two-way kind of communication things, managers who are visible, they will kind of, all the staff and the teams will fare better, you know, when it's a really kind of stressful time, if you like. But I think, you know, in terms of the teams and managers, it is important in this kind of sort of, as we're kind of on the downward curve and the sort of recovery phase, to make sure that they're perhaps having some times for reflections with their teams about what worked, what didn't, what things they'd like to take forward. And some of that might be just about, you know, people being able to talk about their experiences and their frustration or regrets. And sometimes we can't do anything about that, but just acknowledging it and hearing it is really important. So I think we're really good if teams can have kind of time for that. For some teams, that's probably happening more naturally so, if they're getting lots of handovers and times to catch up. For other teams, they've probably had less, you know, opportunity for that kind of thing. Occasionally, teams do want somebody to come in and facilitate that, and that's fine. You know, I know HR have got some additional support there for that. But actually, I think it's probably really important in the first instance, it's just the existing team, if you like, rather than having somebody else coming in. I think it's really important to acknowledge that people have different coping styles, and that's fine. You know, it's absolutely fine. I know times over the last couple of months, there's certainly been more tensions around, but everybody's different. We're all different. But also, you know, to normalise different responses and feelings, and it's okay to do that. And if somebody needs time out, needs time to offload, or needs a quiet 10 minutes, that, you know, that's okay. I think you're going to mention a bit about some of the different types of support the Trust's also got to offer as well. I guess for managers as well, as I was saying before, it probably is important just to kind of be mindful of your staff team, just in terms of if you are noticing that somebody is kind of feeling down for quite a while, or they're not the normal self, or perhaps they're a bit irritable, or they're a bit anxious. It probably is good just to have a bit of time one-to-one, just to ask them how they are and how are things, how they're doing now. We're in this recovery phase. And I guess just being mindful that people might have a lot of challenges on at home, you know, and that might be ongoing for a while as well, really. And of course, looking after yourself as a manager. I hope most managers will get access to some support and supervision themselves as well, because that's just as important for managers to have time out as well.
So I think that's been brilliant there, and like you said, just to let staff know that on the health and wellbeing page of the internet, there's a lot of different options there in terms of smart apps, the national smart apps such as Thrive and Unmind and sleep apps and things like that. The employment assistance program, again, it's anonymous, that people can get telephone support, and Resolve, which again is a trauma response. Again, I suppose this model that we're talking about, the support services we've got in place at Chesterfield, are options, like we're saying. It's not that they're for a period of time, quite a long period of time after this, because like you said, they might not be utilised now. There might be, as people go through these different waves or regress back and things like that. So I think it's important, if you want to have a look on the health and wellbeing internet, it's there. But I think that's been an excellent summary, and again, I find it fascinating. I really do, speaking to you anyway, just finding out about these sort of psychological responses. Now we're all human, and we're in this together, all responding differently. Okay then, Martha, well, thank you very much for your time, and we'll speak to you again, I'm sure. Thank you.
Okay, all right, cheers, Andy. Bye-bye.